We were averaging about 300 cases a day. With a 7-day rolling average, and then more recently that's increased to 350, and now we're in a neighborhood of about 450, 460 cases per day for the last 4 days or so. So that is of concern. We've done some analysis. I think the province and territories have obviously done their own analysis, and what we're noticing, and it's something that I do want to highlight, is that it seems that the vast majority, or the increase in proportion of cases, is among what we call young adults. Whereas, for example, back in May, it was a smaller percentage, maybe a third of cases across the board in Canada. More recently, it's been about 55%, and that is concerning. It's all a matter of what I would call risk tolerance and risk management, both at a population level, but also at a very individual level. So, for example, if you're talking at a population level, from a public health perspective, we can give guidance, we can give you the latest scientific evidence in terms of what the transmission risk, et cetera, and so on. Governments certainly have a role to play in terms of putting certain measures in place using maybe regulatory or legislative tools. For example, some governments have put in place sort of the mandatory use of face masks indoors in public spaces. So that's at a population level. But then at an individual level, you have to do your own individual sort of risk assessment and look at the risks and benefits of whether you want to go into a bar. You have the evidence. Some people, their risk tolerance might be said, no, it's not worth it. Maybe you're an older person. Maybe you've got some underlying medical conditions and you don't feel comfortable going into a bar. Some other individual, based on sort of their own analysis of the risk and benefits, they may say, hey, I'm going to wear my face covering. I'm going to have my hand sanitizer. I'm only going to go with my close group of friends. We're going to take a table away from everyone else with good physical distancing inside the bar. And that might be reasonable for them to take. So it's really, I think, a combination of all those factors, and it's not something for me to personally say, well, yes, you have to do this, close the bars and restaurants. It's much more complex than that.